Okay, welcome everybody to our latest webinar in the National Telehealth Resource Center's webinar series. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Webinars are presented on the third Thursday of every month. The TRCs are located throughout the United States. There are 12 regional telehealth resource centers and 2 national telehealth resource centers. Each serves a focus area in their region, and they are kind of a catalyst for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. We want to do a few kind of housekeeping notes for our webinar today. The audio for the participants has been muted and it will be muted for the duration of the webinar. We will have some time at the end for Q&A. To have your questions submitted to Q&A, use the Q&A icon in your Zoom taskbar, and you can type in your questions and we will review those and discuss that with our speaker here today. It's important that you fill out the post-webinar survey if you can. This really gives us feedback as to which content is useful and helpful for you and helps us tailor future webinars for you. We are recording this webinar and it will be available on our YouTube channel after the event. Today's webinar is hosted by TTech, the National Telehealth Technology Assessment Center, and I am Jordan. I'm the Telehealth Technology Assessment Specialist for TTech. We are a federally funded, grant-funded entity funded through the Office for the Advancement of Telehealth, or OAT. We provide technology assessment services to the 12 regional TRCs, as well as national consumers and organizations. Then we have 3 staff, myself, Doris Barda, and Garrett Spargo. And between the 3 of us, we've been doing telehealth for 50 years. Our speaker today is Tim Collins. He's an epidemiologist with the Alaska Native Tribal Health Consortium. Mr. Collins holds a Master of Public Health in Statistics, wow, and Epidemiology from the Keck School of Medicine, University of Southern California, and a Master's in Psychology. He is a member of the Sault Ste. Marie tribe of Chippewa Indians. So before we get into Tim's presentation, we're going to be talking about opioids and the use of augmented reality in helping people kind of conceptualize and really help educate people about opioids. So we want to talk a little bit about what augmented reality is first. And I'll do this, and then we'll have Tim kind of present what he's doing with the Alaska Native Tribal Health Consortium in this space. So the first conversation we kind of have with people when we're talking about this type of technology is, what is augmented reality? And I find it's helpful to start with a topic people know more about and kind of branch off from there. So we're going to talk about what augmented reality is related to virtual reality. A lot of people have heard of virtual reality, and that's a good jumping off point as we kind of look at this technology. So the similarities between virtual and augmented reality are that both often use some sort of headset technology and hand controls to allow people to interact with data. They provide an immersive and interactive experience, and they're going to have some sort of motion sensor or motion control tracking to see where things are in a 3D environment. Some of the differences between virtual reality and augmented reality is that in a virtual reality environment, the environment is fully digital. It's a fully rendered environment that people see. With augmented reality, it's a mix of digital and physical environment. The headsets that you wear have clear lenses, and you're actually able to see through there, see the real world around you, and see information that's overlaid in the real world. Virtual reality tends to be more processing intensive because, again, it's creating a whole virtual reality structure, where augmented realities can tend to be lighter weight, more self-contained units. And when I'm trying to describe what the experience is like for users, virtual reality is almost more like being inside of a video game. You are a character in an environment and you're interacting with the environment. Where augmented reality tends to be more like a heads-up display, like you might see in the helmet of a fighter pilot, or a situation like that, where you actually see digital information overlaid to the real world. The best way to kind of explain what this is to kind of show you. And so And we will have a little demonstration of that here in just a second. But to talk a little bit more about augmented reality, it really is an overlay of digital information on the real world. It allows users to interact and engage with virtual objects in 3 dimensions. And it tends to be a little bit less disorienting and safer than VR. So we've demonstrated this technology at conferences and all over the United States. And one of the things that we hear a lot is people are concerned about getting seasick or nauseous. And that really hasn't been an issue because the lenses are clear. Because you're able to see and interact with the world around you, you don't have that kind of disorientation that some people experience with virtual reality. Also, because the lenses are clear, because you can see the world, you're not walking into objects with kind of the regularity that you might with virtual reality. So the environment can be a little bit more cluttered. You can kind of have more things going on in an environment, and you're actually able to see and interact with those things. What we'd like to show you next is just a quick video demonstration of a person experiencing an augmented reality application and kind of what that looks like from their point of view.
This is a demonstration of a HoloLens user's recent experience at a TTech technology demonstration. In this recording, the user is able to visualize a 3D mannequin overlaid with anatomical information. The user can walk around, lean into, and otherwise interact with this object. Augmented reality allows digital information to be inserted into the real world and is one of the technologies to watch for the future of telemedicine.
So hopefully that audio came across clearly and you can kind of see what that user was experiencing. Next, we're going to talk just briefly about potentially some of the use cases, and this will lead us into Tim's talk today. What we're seeing augmented reality used for is primarily for training, teaching people how to do things, having them see checklists of things that they're supposed to do, giving them curriculum that they can actually see digitally while they're interacting with things in the real world. It's also really useful for data visualization. We're used to seeing data in 2 dimensions, and that really kind of limits some of the depth that we can give to information. So being able to visualize data in 3 dimensions gives it a whole other layer, no pun intended, and can really help people immerse themselves in data. Radiology is also a really good use case for augmented reality. Being able to review CT scans, MRIs in 3 dimensions can give insights that you might not get from a 2D screen. We're also seeing use cases around remote consultation and guidance. For example, in performing surgery or in emergency services, a headset like this can allow someone to look through the eyes of the caregiver and really kind of instruct what to do, how to do it, and actually annotate on the world that they're seeing in real time. The final use case that we're going to talk about is really what this webinar is about today. We want to talk about immersive patient and provider content. How do we use augmented reality to kind of really show information that may not be as accessible and may not be as easily understandable through kind of traditional 2-dimension means. So I'm actually going to turn it over to Tim Collins here today, and he can kind of tell you about some of the exciting things that NCTRC is doing in this space.
Hi, I'm Tim Collins. I'm an epidemiologist with the Alaska National Center, as Jordan mentioned. We work closely, from the Epicenter, we work closely with the Behavioral Health Division in our work, and that's how this effort with the HoloLens came about. I'll jump right in and say, from what Jordan described, we love this technology. We love the potential of it. Specifically, the augmented reality, not the VR where the vision is blocked, but just the augmented with the heads-up display. But the reasons for that may be a little bit different from what you might expect. The reason that we are interested in it is because it changes for communicating medical information, patient information, what's happening to a patient's body, what data looks like. It changes the relationship of the user with the information. And for our for a lot of the patient population that we work with, the previous way of communicating information to them is an institution communicates at them. The information is directed towards them, and they're just passive consumers. With augmented reality, whether it's a medical model or data, people share the same space as that information. They are in charge of what happens to it, and they can go in on their own terms and engage it. And that is so profoundly different from what we're used to. And as Jordan mentioned, the times that we've piloted this and we've used it with younger people, with older people, to see people who would be ordinarily maybe sit back and not engage in information, not engage in neuroscience, definitely, but maybe not engage the information so much. They are far more active, enthusiastic about getting in there and finding out what's going on. So beyond the gimmick of the 3D, which is just super cool to look at, and it's a wonderful project to work on. It's not, for us, it's not just a gimmick. It's not just putting things in 3D, but it is a new way of engaging patients and clients with information. And that is kind of from other high-profile people in the tech industry. That's kind of what we've heard. If you Google some comments by Tim Cook, Apple also mentions that the augmented reality has a potential to involve people instead of isolating them, and that we would concur with that. So if you do have the opportunity to work on an AR project or develop some application for one, it's not just a video game. It is a legitimate new way of orienting information. So how did we get started on this project, and what are we trying to do? If you have attended any of the Alaska webinars on public health, you maybe have seen this slide. Alaska is huge. It's really big. Our Indian Health Services patient population in Alaska is 175,000. That's the one that we deal with. And that population is spread out over 660,000 square miles through a system of hubs and clinics and hospitals. And the idea of just being able to beam three-dimensional information to somebody in another part of the state, or to work with a patient in 3D by just holoporting it or teleporting it is immensely appealing. So that is kind of the initial thing that got us interested in this. The end result is actually a lot different. What we were interested in, the problem that we were looking at, and the reason we think AR and working in 3 dimensions is exactly what we need. We were looking at how to encourage patients with opioid use disorder to get treatment, and how to make sure that those in treatment remained in it as long as they needed to, and to long-term to reduce opioid overdose mortality. The thing about that, though, that what we found is one reason why people were avoiding treatments, people who needed it were not getting it, because others around them were saying, and this isn't just in Alaska, this is also in other parts of the country, but we've noted it here. People around them were saying, well, you don't need another drug to replace your drug. You're just replacing one addiction with another. And what you need to do is you just need to detox, and then you need to have the will to not use anymore. And that's what I did with nicotine. That's what I did with meth. That's what I did with this. And that's what you need to do. It's just a matter of pulling yourself up and getting a grip on it. That is so not true with what medication-assisted treatment is and how opioids affect people. So the the initial thing that we were interested in is showing the structural and the functional changes that happen after opioid use, how that affects decision making, and how that can affect the way a patient is going to make decisions about continuing use, continuing care. The only way to do that, for us to do that, is to show these brain structures and explain what they do. So the issue with that is it's really hard. Brains are just, anytime you try to visualize it in a cross section and an illustration, it just, to me, it just looks like a pile of custard. This was an issue in med school. It's an issue in publications. In a cross section, it is hard. Even if you're trained to recognize a scan, it's really hard to understand what's going on in a cross section. So the two, just looking at two structures that we want to focus on for this work is the amygdala and the prefrontal cortex. And here, this is a publication by the National Institute on Drug Abuse, it's explaining the same thing that I'm explaining to you, the addiction pathways, how the brain works. Here, if you notice the amygdala, which is what we're interested in, there's an asterisk next to it. And this is a super publication. They do really amazing publications. But in this one, it's just not possible to show it. So you see it says in small print, not visible by cross-section. And again, this is another one. This is the Surgeon General's Spotlight on Opioids, Department of Health and Human Services. Again, this is an illustration of the extended amygdala, not really looking like what this actually looks like in a person's body, and maybe making it difficult for a person to make the connection that here and here, we're kind of talking about the same thing. So the extended amygdala, to me, it looks like a Dr. Scholl's cushion in this illustration. So being able to talk about these structures in 3D is really what we were aiming for. This is a scan showing volumetric changes in gray matter after opioid use, amygdala gray matter after opioid use. And the same thing, these are the same structures. Pretty hard to see what's going on unless you're really trained in this area. So we thought, okay, we need to be able to talk about this with patients. We need to be able to talk to this with tribal health organizations. So what do we do? What are our needs? We need it to be 3D. We need technology that's going to be interactive, that's going to involve people, that doesn't isolate, that doesn't shove them in front of a computer screen or in a visor. That's easy to use, that we can transport, put it on a float plane, take it to a village, and something that'll work for all age groups. And for that technology, our first choice was actually medical inflatables, which we had used for years, and they work, and they're terrific, and they're wonderful. This is an NCTRC medical inflatable of a colon for colon health, and we set these up in communities and events, and people get to come in. Same thing, it's 3D. You can walk into it, you can get information from it, you can interact with somebody who's there. We actually, when we first started budgeting for this, we were budgeting for a medical inflatable. And the people who had to use this actually came to us and said, well, you know, those can be really heavy, and they're not always fitting on float planes when you have a lot of gear. You need a gymnasium to set them up. It takes a lot of time and prep work. It's not a spur of the minute kind of thing. So if you can find something else, you know, that might be, you might want to look for something else. We love this, but maybe there's something else out there. So then after looking at things, we independently came on the HoloLens as our preferred platform. It really, we're blown away by the HoloLens 2 demo last year, and we really wanted to use this technology to develop these medical models and engage tribal health organization leaders, engage people with them. Doing that, we have not produced a working app yet. We're in the process of contracting it out and getting those medical models imported into the system and interactive and getting something actually workable there. To do that, and on a practical side, when you do that, there are pros and cons to using the system. And one of the cons is that there's very little off-the-shelf stuff for the type of work that we're trying to do. We have to be essentially app developers for this, and you have to learn what you kind of know what you don't know in order just to be able to contract it out. So for the experience that we're doing, we have storyboarded every second of instructional content by audio content, 3D content, interactive content. So everything is storyboarded, and it will go to an augmented reality producer, and we will get our interactive informational experience produced that way. We're able to do a lot of cool stuff with our own models that we have, but we will be producing a separate experience. So even then, just finding a company that is capable of doing this work is a little bit of a challenge still, and that is one of the drawbacks. Another potential concern is licensing. That every time you go into the environment, you have software, you have 3D models, you have medical models, you have image licensing, and those are things you're essentially an app developer, so it's just something that you have to kind of think about or maybe work your way through. The hardware is hard to get right now. We like the HoloLens. We think that's a terrific app, a terrific environment to start with, and to branch out from. And some of the features on the HoloLens, Jordan didn't show you some of the more advanced features. Go to YouTube, you can see them. You can scan a person, you can scan a physician, 3D, and someone puts on the HoloLens, that person walks in, actually sits on a physical chair in the room, interacts with the table, the chairs in the room. You can do that, but it's some of the really advanced stuff is for some organizations might see it is a little bit costly to experiment with. The pros, though, are it's getting cheaper and easier all the time. And even since we started on this last summer, the landscape has changed tremendously. It's got much easier, and there are many more options out there for us to put content in. We're kind of expecting for consumer glasses that are easy to use that will do much of this. The advantage that we like is the literal scalability of the medical models. That you can make it, if you can't see something, I can't see the fornix, fine. We'll make this whole model, you can make it as big as a house and walk around inside it. You can shrink it and put it on a tabletop. And everybody gets to see the same thing. Everybody gets to see the same model. It's amazing. Neuroscience, especially, people are really excited about this. And even in publishing papers, there's an effort to get for neuroscience publications to get similar three-dimensional images like we're working with here. And it brings people together. So this is what I mentioned. We're currently doing something, exploring what we can do in the HoloLens. This is just one that we made. I'll show you this one. So this is a limbic system, and this is the brain structure that we had such a hard time talking to people about. We tried 3D printing it. The 3D models are really unstable and they break really quick. So the hologram is perfect for any kind of neuroscience. Isn't that terrific? This is a prototype handout, and what you're seeing on the table, there's no handout there. The handout is virtual too. So it's spatially anchored to that table. This is another view of what it will do, and this is super cool too. This one, this is a real handout. This is a physical paper handout. It is sort of digitally stapled to the hologram is stapled to the image with image recognition software. So you can hand it around. And the content that you see in the handout, we're working on getting that interactive, so you can poke on the cingulate gyrus and get information on it, or the putamen or whatever. So all that information in the handout will be interactive in the medical model. It might be, I'll just throw this out there. These are prototype handouts that we're working with, and you don't even need, once you start crossing platforms with this, your user doesn't necessarily need to have a set of lenses to use this. Your phone has the same software, the same chips, the same spatial recognition capability. It'll find the surfaces, it'll plant the model on it. So you can actually, if you like see a patient in Anchorage, suppose that patient goes home, and I'm not a telehealth person, but this is a potential scenario that I could see just from working on this. You see a patient in Anchorage, they go home to a rural community. You're not going to send them home with a pair of HoloLenses so they can see, their medical information later on. It's just not practical. And they're probably not going to go to a hub to do that. But no problem. What you can do is you can send them an email or an attachment. All of this isn't a huge, massive file. So they get their MRI scan. Physician calls up, says, "Hey, I want to talk to you about your scan." They pop it up. They can plant this on their dinner table. The same thing. Rotate it, interact with it. And the provider could be wearing lenses, and they can be looking at the same image. And if you go over to YouTube and look at HoloLens and MRI, there's quite a bit of interesting work being done on just in the MRI section. So in thinking about this, we weren't locked into always having glasses on, going and using glasses. We're definitely interested in the cross-platform applications for this. And I believe that's it.
Okay.
Mr. Burton?
Hey, thanks for that, Tim. So I'm going to move this back so we can kind of both be seen here. We want to kind of open the floor to any of the questions that may have come in. We're going to take a look. I'm not seeing any questions that have popped in. One of the things that you've talked about previously that I found really interesting was, how do we use this to not only engage patients, but to engage family members and community members? How do you see this kind of working? Like when you bring a HoloLens to a community, what can you kind of give us an image of what you see that event kind of looking like, or how do you see that kind of going?
We're planning on getting about 4 or 5 lenses this year, and what we will do is the Epicenter is a part of NCTRC, but the Epidemiology Center, we work mostly with leaders of the tribal health organizations rather than directly with patients, or even community members. Everything we do with the community is going to be mostly with the THO, a tribal health organization. So in our visits with these organizations, with the leadership, we can use this to have a dialogue about these issues and to raise awareness about certain the neurophysiological effects of certain substances. And already, even just with the storyboards that we've done so far, and with the limited work that we've done, we are already planning for additional modules. We're ready to produce the opioid use, but we've been asked to produce for neonatal abstinence syndrome, for alcohol, methamphetamines, for the neurophysiological effects of those substances, and to be able to communicate that. For us, a lot of this is about policy, whether or not a community is going to provide MAT, how to support clinics and rehabilitation resources, things that can help patients. So working with leadership is one approach that we've had, and then just making it available to kids to encourage. Kids love it. We've done some work with school kids, and it really increased their interest in medicine and in science in general. The response was tremendous.
I know this is anecdotal, but we got to experience a group of people kind of working with holograms. Can you talk about kind of what that experience is like? And you've talked about young people, but one of the things that I've always kind of been surprised at is how accessible. Let's see if we can get this camera to focus in a little bit better. How accessible this has been for older people as well. Why this is? I think it may just be that we're losing a little bit of resolution, but it's okay. So can you talk a little bit about what you've seen for user experience in terms of immersion and kind of how you've seen people kind of interact with technology?
For user experience, I learned a lot from TTech here, from Jordan. For user experience, I was concerned that people needed a lot of instruction on how to do the gestures, how to interact with the software. There is a tutorial that is automatic. You can pop it up as the first time somebody uses the system. But what I think works better is to just give people general instruction and give them time and space to work it out on their own. And for older people, that seemed to be more. It's actually really intuitive and really easy to use. If you don't get the first gesture, you'll eventually get it and figure it out. You'll learn it even with no instruction whatsoever. So for older people, it was they had no difficulty doing that.
There's a chat question that, or a question that came up in the Q&A about any data on improved outcomes. Have you seen any data around using augmented reality for instruction or for patient outreach?
Absolutely. Funny you should ask. Yeah, as part of our, we did not commit to procuring it or to designing anything in this environment until we did a comprehensive literature review on whether or not it actually works to inform people. Most of the literature is focused on retaining information that has been given to you. I haven't really seen any on what we like, the part about changing the locus of control and putting people in charge of the information. So even if it was even on learning, for us, the interactivity part of it would be enough to get us in that environment. But yeah, there's plenty of research. Do a journal review. There's plenty of research on AR and VR promoting retention of information, engagement of information. In Alaska, we are just we're spatial people. We think in terms of landscapes and 3 dimensions, and from wildlife, just thinking about it in 3 dimensions. And it's just kind of a more intuitive intuitive platform for us than working in 2D on a computer screen.
So we had a question that came in that said that this is amazing. And that's not really a question, but it really is. And I think one of the things that I've seen that people have been, that I like to kind of mention to people is that it really is a lot more immersive than you might think. So even just showing you these quick videos and things like that, being able to experience it versus even seeing YouTube clips or things like that, it's surprising how quickly and how kind of completely you kind of go into whatever 3D world that you're in, kind of walking around an object, kind of moving your head in, and really how quickly that's engaged. Another point of the technology that is kind of interesting and that we really hope to see further developed is the ability to link multiple augmented reality headsets or phones or things together so that people can have a shared augmented reality experience where they're all looking at the same virtualized objects at the same time. We've got some other questions that have popped in. Let's take a look at those.
Yeah, good luck with that. I don't know what that is. This was a fishing expedition for me because I had no experience in 3D augmented reality, even in gaming. I don't game or anything. I started working in Unity. Somebody said, "Oh, the gaming engine." I said, "Yeah, I guess so." So yeah, there really isn't a 101, and even on some of the more prominent websites that you would think would have information on that, there isn't a lot out yet. It's changing all the time. The Microsoft has an app store for the HoloLens, and every time you go to it, it is more and more populated with really cool, amazing features. If I can say for the Epicenter, one thing that I am really excited about, that we've gotten really good reaction to so far. Epidemiological data is it's a bit of a slog to go through sometimes, and visualizing it takes a while to orient to what you're actually looking at. So one thing that we're able to do in this environment is never been able to do this before. For mortality rates, and we're looking at substances, for incidence and prevalence and mortality. For rates, the general way of doing this is rate per 100,000 out of the population. You generate a line graph or a bar chart or something, and people look at it. With this, what we're doing though is we're doing data visualizations where every person in the patient population is represented by a data point. So there's a cloud of data points over the table, and you can see for the patient population, there's 160,000 dots there. And then you interact with it, and you actually touch it and see you're a part of that data, and you can see what the incidence or prevalence or mortality is for any given issue. And the sense of ownership there and being a part of something is just you can't get it through a 2D screen. You're physically a part of it in the HoloLens environment. So that visualization is something that we're also doing that is looking really cool so far.
And to kind of, if you're wanting to learn more about this technology, I would point out a couple things. Start with your phone. So you can get a good experience of what augmented reality is like using a phone-based system. You can look in the App Store, if you look for medical holograms, that most of there are paid anatomic atlases and things like that, but most of them are going to have demos that you can kind of go in and you can look at, you can experience. If you can get your access to a HoloLens, it is good to see that. If you happen to be, and this is a little bit of self-promotion, but TTech travels with this technology. So if your regional TRC is hosting a conference and TTech is going to be at that conference, we can absolutely have you have that experience when we go to these conferences. And it's one of the things that we really enjoy doing and having people experience. But looking for medical holograms, you can see a lot of demos, you can experience the technology. Really, the industry that has the most experience with this is the video gaming industry. They've created, they're really used to making 3D models. When you look at actually going and starting to develop, most of the time there are regional companies, people in your regional area. One of the things that we've heard from people over and over again is whatever you can do if you're developing an application or working on this, being in the same room as people, being able to talk these things out, being able to storyboard and kind of interact as real time as possible makes this whole process work a lot better. Let's see if we have another question pop in. So the question is, what is the current talent development arena as to supporting these ideas in Alaska in a practical sense? This is too early to think. What is the timeline looking like? I think I'd like the question maybe clarify just a little bit. I think maybe a question we can ask is, what kind of timeline are you kind of imagining for seeing this sort of technology in the Alaska tribal health system? And again, this super ballpark, I know it's early days kind of for your development process.
For our own work, we expect to we expect to have a kind of a working product in the next few months. The putting it together is not for what we've storyboarded. It's not really that complicated. We decided to go with a fairly simple, straightforward presentation of the information, and we don't expect that to take very long. The medical models are all built. All the 3D models are already built, and it's just putting them in the environment. But yeah, the experience is in the gaming community, but we haven't seen a lot of people have actual experience with the lenses. There are tons of gaming programmers, but not actually experiencing the lenses. There's a workaround there where there is a HoloLens emulator that will sort of simulate the HoloLens environment working on your PC. So you don't actually need a pair of lenses to test if your application is working. But we're still learning what's available in Alaska.
And that's another thing to kind of talk about is when you have these 3D assets, when you have these models and you own the licensing to them or you've contracted for licensing, you can use them in multiple different applications. So these are resources that can be moved from different platforms into different applications, and you can build different things around these 3D models. And that's kind of how a lot of these things work. Is you have a 3D file, you have textures that kind of wrap around the file. And you can change the textures, you can change the models and things like that, and then you can put them in different environments and kind of display them. Some of the ways that you can kind of think about these 3D presentations is some of them are really interactive. They have a lot of gesture controls. They have you zooming and kind of doing a lot of that. And some of them are a little bit more passive, where it's more of a presentation, where the information is presented to you and you're able to move around and interact with it. You can move yourself, but the presentation stays fairly static in terms of where it is in the room, kind of how it's hung. So there's different ways to kind of approach the level of interactivity that you want to have with your audience. Let's see if there's more questions that popped in. So we have a comment here, a question. I can see it will be great patient education tool for those with brain tumor or traumatic brain injury, to show them the areas affected and to touch the location, to show the functionality related to the region. I imagine that this has been done already. So are you aware of any kind of programs or applications where this is being used to kind of show people what traumatic brain injury looks like, and then kind of what the effects of that are?
If there are some, we're not care providers. We're an epidemiology center, so that wouldn't be my area of specialization. But I have seen some YouTube videos on that and seen some programs nationally that are exploring that use. I don't think it's really matured to reality that much, though. Right. But I think it's going to advance so really quickly, and I think it's going to be as prevalent as cell phones in the very near future, I think.
Some of the neat demonstrations that I've seen around this have been around MRIs. So you can take MRIs that have pathology on them, and you can actually interact with them in 3D. It takes some work to get the models moved in. It wouldn't be kind of a just-in-time thing at this point. But I've seen some cool demonstrations where you're actually able to visualize a patient's head, with skin and everything like that, and you're actually able to lean in to the skull, through the skull, into the brain, and you can actually visualize that dark spot, a clot on the brain. Or you can also lean into a person's eye and actually visualize the optic nerve at the back of the ocular socket. So there's a lot of potential in kind of the radiology, and absolutely, if you had an MRI with pathology, another really cool use case for this is in the education. So as we're teaching a whole new generation of medical professionals and how to look at this and how to kind of, learning anatomy with 3D tools is a whole different game than it was when you had the anatomy textbooks with the clear overlays, and you're kind of trying to visualize what things look like in 3D. Let's see if we have more questions that popped in. So, from TTech's point of view, what we've seen is that this technology, the hardware for this technology, has moved forward a substantial amount in the last 2 to 3 years. And what we're starting to see is, because that hardware is so usable, so functional now, we're starting to see the software kind of catch up to it. And we're starting to see programs that hadn't thought that this was something that they could really do inside their organization begin to look at this and say, there's some really accessible and really powerful hardware solutions out there. Let's build some applications and some solutions around them. So we're just starting to see this kind of creep in, and like we've seen here, this is kind of early days for the technology, and the hardware is only going to get better. But we're really waiting for kind of the software and kind of the development space around these medical applications to kind of catch up. So Tim and the team here with the Epidemiology Center are really kind of pioneering some of the things happening in that space. Okay, so that looks to be like most of the questions we have kind of coming up in the QA. I want to thank Tim for being here and kind of talking with us about this. Tim, do you have any kind of last thoughts or words before we close out?
Yeah, if somebody's interested in learning more, I would suggest, as an organization, just get a pair of lenses, go to the, get a Unity account before you, and just see what, just kind of keep an open mind about how to apply it. Don't be locked into the idea of always in lenses with people. It's a little bit more flexible than that.
Okay. Thank you, Tim. Again, this is really exciting stuff. This is one of the things that we've been really excited to kind of look at and to partner with. We want to talk here just briefly about the next webinar that's coming up. So again, this has been a part of the National Tribal Health Resource Center's webinar series. Again, these happen every month on the third Thursday of every month. There's a variety of topics. Ray does a really good job of making sure that information is kind of out there and available. Our next topic has yet to be determined at this point, but that's going to be March 19th, and you can see the times that are noted there. The last thing we want to kind of mention to people is it really is important for us that you fill out the survey. You should be taken to the survey just as the webinar closes, but if you're not able to, you can also take that SurveyMonkey link, and it'll take you to our survey. This really helps us create content in these webinars and really other National Telehealth Resource Center programs to make things that are really valuable to you. So we hope that this has been invaluable to you. We hope that this has really kind of inspired some thoughts and some plans, and really interest in the technology that we've discussed. And we hope that we can continue to make new and interesting presentations for you. Again, this webinar is being recorded and will be available on the National Consortium YouTube YouTube page. And you can also go to the NCTRC website and follow the links from there to the recording. We want to thank everybody for attending today, and we will go ahead and stop the recording, and thank you very much for your time.